This is the true story of how one man's relentless pursuit for justice in medicine changed countless lives. This is the true story of Paul Farmer, a physician, a medical anthropologist, and a tireless advocate for global health equity. But before we explore today's story, this is Man Friday Fire Pit. If you like this content, please remember to like and subscribe to the channel. And if you have a story that needs to be heard here, maybe drop us a comment down below. Paul Farmer was born October the 26th, 1959 in North Adams, Massachusetts. Growing up in a modest household, Paul was deeply influenced by his mother, who instilled in him a sense of compassion and the importance of helping others. As a young man, Paul developed an interest in medicine and social justice, inspired by the disparities he saw in healthcare, both at home and abroad. Paul Farmer's journey into global health began at Harvard University, where he studied both medicine and anthropology. His unique dual focus helped shape his understanding of the link between poverty, social inequality, and health. But it was his deep commitment to serving the underserved that led him to a far greater calling, working in Haiti. In 1987, Farmer co-founded Partners in Health, an organisation dedicated to providing high-quality healthcare to the world's poorest communities. Partners in Health, Farmer brought modern medical care to rural Haiti, where he began working in the underserved community of Kanj. His revolutionary approach focused on treating the whole person, addressing medical needs as well as social and economic factors that contributed to poor health. Paul Farmer's approach emphasised the importance of community-based healthcare, ensuring that even the poorest patients had access to medicines, treatment and follow-up care. He fought to make essential drugs affordable, and his work in Haiti proved that healthcare could be both effective and accessible, regardless of income. Paul Farmer's impact was not confined to Haiti. Over the years, his work spread to countries like Africa, Latin America, and Russia. He advocated for the treatment of diseases such as tuberculosis, HIV/AIDS, and multi-drug resistant tuberculosis, which disproportionately affected the world's poorest people. His groundbreaking work in these areas helped change the way the global health community viewed the intersection of poverty and disease. Farmer believed that health is a human right and not a privilege, and he fought relentlessly for this belief. He spoke out against global health inequalities and championed the rights of marginalised communities, urging governments and institutions to provide care to all people, regardless of their financial situation. His advocacy for social justice was deeply entwined with his medical practice. Dr. Paul Farmer passed away on February 21st, 2022, but his impact endures through the lives he saved, the institutions he built, and the countless people who were inspired by his example. His work serves as a beacon of hope for a world where healthcare is a universal right, and his vision of health equity continues to guide global health efforts.